If I try to wear cosmetics, it really ramps up my pain from, I'd say, a 6 to a 10, and then it's a long-lasting effect. It puts me out for the next day.
It's ever-changing cosmetic landscape that is affecting our dry eye patients, especially with patients who might not necessarily have significant symptoms in the early stage, and then they start with eyelash extensions or tightlining their eyeliner or using certain products around the eyes that can essentially push them over that threshold.
The use of cosmetics around the eye can impact some patients with dry eye disease in a variety of ways.
First, let's talk about habits or cosmetic habits around the eyes. So I think in the past 3 years, we've seen a huge uptick in eyelash extensions.
Eyelash extensions come in a variety of sizes and shapes and are usually applied by an experienced esthetician using tweezers and a specially formulated semi-permanent glue.
What we're creating on the surface of the eye is essentially a wind tunnel where air is now trapped in front of the surface of the eye and exposing the surface to more evaporative stress than we might otherwise see if we didn't have those eyelash extensions or longer eyelashes. And there is actually an ideal length of the eyelashes. They're supposed to be 1/3 the length of the eyelid. So we have these very delicate glands inside the eyelids called the Meibomian glands. And when we start to put eyeliner on the openings or the orifices of the glands, we create a ceiling where now those Meibomian glands cannot produce enough oil, or they cannot release the oil. And if we're not releasing oil, then we're starting to see a breakdown in that tear film and patients are starting to feel dry eye. So where we put eyeliner is also very important. Makeup travels almost 1 inch from where you applied it. So if I applied concealer all the way up to my eyelid margin, I can at some point throughout the day expect, if I looked under a microscope at your eyelid, I can expect that to have traveled and maybe sometimes even have traveled to that eyelid margin, and that could be creating that sealing on the orifices of the Meibomian glands so they're not able to release oil throughout the day when you blink. So you might not have it intentionally applied any makeup around the eyelids or on the eyelids directly, but it could be traveling. So we have to be very careful.
If you start to feel symptoms of dry eye disease, talk with your eye care professional about cosmetic use and how it may be impacting your eyes.
My best recommendation for patients that are having trouble tolerating makeup or are getting worsening of their dry eye disease symptoms when they wear makeup is to switch to a hypoallergenic product, and also to make sure that they're using something that's very gentle and mild when they take off their makeup. It is really important to get the eyelids to be very clean. I also recommend things like changing out your mascara on a regular basis, as well as considering what you're applying to the eyelids. For example, we all use makeup brushes, making sure those are clean and have good hygiene.